So large multi-joint exercises are the most effective way to increase strength, and they should be the foundation of a resistance training program. However, if your client cannot perform these compound movements, then you should work on progressing their abilities until they can. It's important to note that unless your client is planning to compete in specific barbell sports, then strictly practicing the common barbell lifts is not necessary. We are using them as a foundation upon which modifications can be made to accommodate client needs. It's also important to note that throughout these videos, we're going to be talking about form in a manner that should be taken as guidelines and a starting point. And the most important thing to emphasize is that your clients should be comfortable in all of these positions. So let's go ahead and start with the deadlift. I'm going to ask Jordan to approach the bar. While he's standing upright, the bar should be about 1 to 2 inches in front of his shins. His feet should be about a foot apart to start with, and it's important to note that as his feet go further out, he's going to be increasing the external rotation in his feet. Experiment with foot placement until you find somewhere that's comfortable for your client. Next, I'm going to ask Jordan to bend down until his shins are touching the bar, and then he's going to push his hips back and keep his chest high. So now that Jordan's in the bottom of the deadlift and he's grabbing the bar, I'm going to ask him to tense his lats to stabilize his shoulders. He's going to maintain a neutral spine, which isn't necessarily a flat spine, and he's going to have a neutral head placement. His head doesn't need to be perfectly neutral, but he should be avoiding the extremes. For the pull, he's going to pull back and up in a diagonal pattern, keeping the bar close to him. And when he's going diagonal backwards, it gives us a counterweight for when the bar starts getting heavy. Okay, and for the descent, it should not be an uncontrolled drop. It should be a controlled motion. We are now going to go over some common faulty movement patterns or compensations for the deadlift. The first is starting with your hips too high, and in this position, you're not utilizing the most efficient lever arms to lift the maximum amount of weight. The second is starting with your hips too low. Again, you're not utilizing the most efficient lever arms. The third is grip width. So first, you can have a grip that is too narrow, and this is going to block your knees from being able to come forward. The third is having a grip that is too wide. This is going to make you come lower down than you need to in the starting position, and you're going to have to lift it further to the top to get a lockout. The final compensation we're going to review is improper bar placement over the foot. So many people start with the bar well too far away from their body, and this is going to create inefficient lever arms again, but it's also going to result in unnecessary energy expenditure, as eventually you're just going to have to roll back anyway to maintain your counterbalance. Okay, so now we're going to talk about cueing and modifying the deadlift. So here's some 3 cues that we're going to go over. We want to encourage our clients to get into their most advantageous torso angle while maintaining a neutral spine. Depending on how your client responds, a chest up or a hips back cue may be appropriate. If the client has increased hip flexion, a chest up cue may be preferable. If the client is too vertical and their deadlift looks closer to a squat pattern, then the hips back cue may be more effective. Keep it close is referring to keeping the barbell as close as you can to your body for the lift. Keeping it close will do several things, including reducing the moment arms to allow the most efficient lift, decreasing the chances of losing control of the weight and introducing unwanted movement, and allowing our clients to lean back in their lift. This will create a counterweight to allow solid foot placement on the ground and help with recruiting muscles in the posterior chain. And finally, I've found that encouraging my clients to push the ground away instead of lift the weight up helps them to approach heavier weights with more confidence. Now, when we need to modify an exercise, we always want to keep in mind our client's limitations. If they're having a little bit of back discomfort while deadlifting, then our goal would be to redistribute some of the stress to other tissue. If we find during the initial consultations that they are lacking ankle dorsiflexion range of motion, then we need to build exercises with this in mind. However, just because a client is having pain or discomfort with a particular exercise does not mean that we immediately have to get rid of that exercise. As we mentioned in our introductory video, form is only one piece of the pie. If you have ensured that your client has been properly warmed up and you are confident that your programming and load is appropriate, then the next step is to start changing the exercises. And here I'm presenting a hierarchy from most minor changes to more drastic changes. We want to first ensure our client is using proper abdominal bracing during all lifts. Then we want to start changing modifiable factors. If neither of these approaches change anything, then we want to consider changing the range of motion or finding another exercise that feels better. So first and foremost, reinforce proper bracing with the client. We really want to lock down the trunk in a neutral position, and this is accomplished by contracting all of the core muscular. That includes posterior, anterior, and inferior or pelvic floor musculature. Specific to the deadlift, we also want to ensure that our client's shoulders are locked in by contracting the lats. Next, we want to change the modifiable factors. These are often little things that produce immediate benefits. In our videos, we introduce general form criteria to use as a starting point. I want to again reinforce that every client has a different body and every client is going to move differently. Tailoring the exercise to each client is going to be important, and we can do that by making small changes like foot width and rotation, torso angle, and tempo, or how fast we complete the lift. Now, if you've played around with the exercise and nothing really seems to be changing, then it might be time to make some bigger adjustments. On this slide, I'm going to talk about changing the range of motion of an exercise, but the next slide and another option is picking a new exercise. There really is no right or wrong in which option you pick here, and it largely depends on what's going on. Earlier in the course, we introduced the concept that you should never feel locked into any one particular exercise and insist that the client performs that one exercise. Many of our clients are not planning to compete in anything, yet increasing the load on the bar is a very important measure to them and might alone be one of their goals for working out with you. But many of our clients could care less and just want to exercise without it hurting. Your client's goals are going to play into which direction you choose to take for modifying or replacing an exercise. And there are arguments for using either approach. You can argue that you should always perform exercise using full range of motion if you can, and if replacing an exercise lets you do that, then go for it. You can also argue about the principle of specificity in motor learning. If the client is still fairly new to exercise, then it might be easier to learn the same exercise in a decreased range of motion and allow appropriate loading in a timely manner than it would be to replace it with another exercise and have to learn a new movement. Again, there is no right or wrong answer, just something to think about when making your decision. And I would encourage you to take a step back and look at the overall context of what's going on to make the most appropriate choice. So for our range of motion, just find something that doesn't bring on symptoms. Usually this means avoiding end range of motion. It's important though that after we train like this for a while and let everything calm down, we want to slowly reintroduce range to our client. This might look like lowering the pins on rack pulls by 1 notch each week until you get back to pulling from the floor. As I mentioned, substituting an exercise is another option. If the purpose of the deadlift is to axially load the posterior musculature, then we want to find another exercise that accomplishes the same goal while redistributing forces. For the deadlift, this could look like a trap bar deadlift or a dumbbell deadlift to allow more upright torso and transfer more of the load into the legs. This might be a stiff leg deadlift. And if axial loading against gravity doesn't feel too good, then maybe we should try some barbell hip thrusts to work our posterior chain.